presume that you, as the spokesman for your panel, are convinced that your findings are accurate and that any deviation from the original autopsy that was conducted under very highly charged emotional stress, the fact that the first group of physicians were involved with trying to attempt to save the president's life rather than determine entrance and exit wounds and so forth. And you are persuaded today, as you testify here, that your findings, the findings of your panel, are accurate, and that the previous findings that were different are in error?
The ones we're talking about, the placement of the bullet in particular, and in the back of the head and the perforation in the neck, we do not, on further discussions with Dr. Perry, Dr. Carrico, Dr. Shires, have any disagreements with the original surgeons who did the operations. There are some disagreements with the doctors in Bethesda, and you point out, in addition to everything else, when the doctors did the autopsy in Bethesda, in a military situation, with a lot of superior officers who are not forensic pathologists present, it creates a pressure, I think, that we are better able to control in the civilian setting, where the medical examiner can tell the chief of police or the mayor's representative or the chief rabbi, please leave the autopsy room and we will do it under our terms. We can do that in a civilian life. It is difficult to do that in a military setting, and that's where some of these disagreements still persist.
Well, I think that this atmosphere should have been pointed out for the record, and appreciate your comments. Thank you, Mr. Chairman.
Thank you, sir.